Hello everyone, today we will talk about diphtheria. First, what is diphtheria? Diphtheria is a kind of disease that makes your tonsils inside here sweat and it will become red. So, what causes it? First, we need to know what bacteria causes it. First, we have the Corynebacterium diphtheria. This is a helpful bacteria to our body. But why? Why does this bacteria have anything to do with diphtheria? Well, this bacteria is invaded by a virus that has toxins, a gene that makes something to produce toxin. In this case, the Corynebacterium diphtheria is forced to make exotoxin. It is a kind of toxin. Now we have the type of diphtheria. First, we have the respiratory diphtheria. This is an infection of the upper lung or the upper respiratory tract, and this is the most severe form. Next, we got cruci type diphtheria. This is a skin infection that causes gray membrane on the tonsils, and it makes the membrane or your two tonsils in your mouth that swell like this, it will be swell and it will be turned gray. So, what are the symptoms? First, the symptoms are gray membrane on the tonsils. Next, you have sore throat because the bacteria lives on your throat. Next, you got a fever, a chill, and you got fatigue. Next, you got swollen neck glands. Then, you have breathing difficulty, and lastly, skin occurs in the skin infection. So, if the diphtheria is so dangerous, what treatment do we have? First, we have the DAT. This is a kind of medicine that will neutralize the exotoxin produced by the bacteria. Next, because it's caused by bacteria, we can use antibiotics. We can use penicillin, androgens, and azithromycin. For a vaccine, we have DTaP, and for booster, we have Tdap 11 to 12 years old, and TD or TD for every 10 years. So this is about diphtheria, and thank you for listening. Bye bye.